How does the association navigate through these two kind of competing interests? On the one hand, cost containment, but on the other hand, higher reimbursement rates.
Yeah, it's a huge dilemma. There's no question about it. But we think that you can reallocate some of the money in the system today. So administrative costs, for example, are huge. Every insurance company having its own method of billing, submission of bills and adjudication of claims and payment, big issue. A clinical variation, why some treatments are used more in some areas of the country than others, not showing different results. The incentives towards utilization rather than towards prevention. You have to fundamentally change all of the pieces of this system. As Stephen Covey says, every system is perfectly designed for the results it gets. Well, we know the results we're getting. We have to change some of the fundamentals and do so over time.
If you were to look at the proposals put forth by Senators McCain and Obama, and you could pick and choose, are there pieces from each that you like?
Yeah, I think it's, and it always gets addressed as an either or, and I think it's a both and kind of solution. Do we need more pooling of risk and more sharing of risk? Sure we do. We're 300 million people. We ought to be able to spread risk across the U.S. population and actually manage risk rather than try to avoid it. Do we need individual responsibility? Yes, we do. We need more awareness that a lot of the decisions we make in our lives day in, day out affect our health, and that we have to be, in one way or another, incented to pay more attention to that, take better care of ourselves, use the system less, use our own choices and decision making more. So you do get the more socially oriented approach from one party, the more individually market oriented approach from the other party, and I think the balance is right down the middle somehow to say we need both of those kinds of approaches if we're going to make this thing work and if we're going to sell it politically.
Well, I'm going to try to pin you down for
Sure.
a moment. Are there issues on which you would not negotiate, that there are certain lines in the sand? If you had a seat at the table come next January, where would you not negotiate?
I don't think you ever not negotiate. If you go into the situation like that, you've come in with answers rather than a desire to find common ground. So our board intentionally has not gone to that kind of approach. Now, clearly, if we don't have a payment system that enables providers to be in place, to be up to date, and to deliver the needed services, but they're carrying all of the risk and responsibility for the quality of those services and so on, that's just out of balance. So you do have to have comprehensive reform, but you also have to have balanced reform. You see that debate these days in terms of coverage. Should there be an individual mandate? Mm-hmm. Should there be guaranteed issue by insurers? Well, you can't have one without the other. There has to be a balance. So yes, there are some areas in which we feel very strongly about the right way to do things, but I think you have to be open to a broader conversation if you hope to find common ground. Our major concern is that the hospitals, just speaking for us, but obviously physicians and so on are key partners, we just can't sustain this system the way it is today. In an awful lot of communities, we need some help, and we know that we have to change as part of that in our operations, but we also need some changes on the other side to get the right balance into the system.
Let's say for a moment that the system does not change. 5 years from now, what's the picture look like for your members?
I think greatly reduced access for the American public. I think
because hospitals have closed down?
Fewer facilities, fewer range of services in a given community, fewer physicians and nurses. We have a terrible shortage of healthcare personnel right now, and we know that it takes 10 to 14 years for a physician, farther they go in their specialty, to come through. 4 years for a baccalaureate level nurse, so many years for a physician and nurse to gain the right experience afterwards. So we've got significant issues right now that are curtailing people's access to the system. And it's just going to get worse if we don't address the needs.
Okay. Thank you very much for coming in today. I appreciate it.
You're welcome.
The Kaiser Family Foundation presents health08.org, election news, analysis, and events.